If you've seen a headline saying that HRT can cause autoimmunity, then this video is for you. Maybe you've been on HRT for a few months or finally considering giving it a shot after years of hesitation. You might even be in Facebook group right now typing, "Should I stop?" with complete panic. I want to talk to you, and I want to talk to anyone about to share these headlines with you, because the study that they're referencing is real and the data are real, but the way that it's being reported, taken out of context, without any research literacy, and without really understanding the exact women that it could apply to, is exactly what is getting women scared into suffering in silence. So here's what we're going to do today. We're going to review what the study actually says, what the biology explains, and the specific questions that you can bring directly to your provider if any of this resonates. So stay with me. And here's why this matters beyond just the findings from this one research study. In 2026, estrogen-based hormone replacement therapy has more than doubled compared to what it was in 2018. Women aged 45 to 54, most of us watching this video, are accessing hormone replacement therapy at 3 times the rate just a decade ago. 1 in 20 women in this age group now has an active prescription for hormone replacement therapy. That's not just a trend. That's a complete reversal of where we were, which means women are finally getting relief and also exposed to headlines that can scare them right back into suffering. And we were denied that relief for a long time. For more than 20 years, the FDA put a black box warning on all HRT products. That's the most serious warning that they issue, all based on a 2002 study where the average participant's age was 63 years old, more than a decade after the average woman goes into menopause. The warning label stayed, and women and their providers stayed away from HRT. In November of 2025, the FDA removed this black box warning, and now tens of millions of women have full access to HRT. But a single observational study is now circulating in spaces where women, already hesitant, already scared, and unsure, are looking for a reason to possibly step back, and that's why this matters. And I want to be transparent because I do have skin in this game. Not because I'm getting kickbacks from Big Pharma, but because I am on HRT and I have 3 diagnosed autoimmune conditions. If I had read the headlines before I started HRT, I might not have started at all. I had the crippling fatigue, the brain fog, the achy joints and pains. And at that time, it was attributed to just shifting hormones. And we thought that HRT would be the answer. Getting onto HRT improved a lot of symptoms for me, but not all of them. And that gap between what improved and what didn't allowed my provider and I to ask the deeper questions, investigate further, and I finally got the answers that I had been seeking for years. HRT didn't create the problem, but it did remove a critical variable, which made the real problems easier to see. And that's what I want to give you today. Not just my story. The framework behind it is what matters. Before we get into the nuts and bolts of the study, here's what you're walking away with from this video today. 1, what the study actually shows and what it cannot show. 2, why autoimmunity clusters around midlife and it has nothing to do with what you're taking. And 3, the exact questions and labs you can discuss with your provider to shorten the 4 to 7 year average window it takes to get a diagnosis of an autoimmune condition. The 2025 study published in Rheumatology is real, and the findings are real as well. Researchers looked at nearly 1,700 women diagnosed with either lupus or systemic sclerosis and found that women who used HRT had about a 30% higher odds of lupus and 40% higher odds of systemic sclerosis. But here's the key. That's higher odds of diagnosis, not higher odds of developing the disease. And that distinction is very important. This was a case control study, and this type of study can show that two things can happen at about the same time, but it cannot show that one caused the other. So what could explain the association? And I'm going to go back to my particular story here for a second. I started HRT. Some symptoms improved, others did not. And that made it clear that it wasn't just shifting hormones, that something else was going on. That's what led to further testing and my diagnoses. That's a very biologically plausible scenario and one that the OWN study's authors also acknowledged. Women seek HRT because we generally feel like garbage. And feeling like garbage is also some of the early warning signs of autoimmunity. Now these women are in the healthcare system and they're seen more consistently for follow-ups, to find out how the medication is working, to check on their symptoms. Someone is talking to them and they're able to look deeper and get diagnosed. And this is where it's important to point out once again that the average time it takes to get an autoimmune diagnosis is 4 to 7 years. And women often see an average of 5 different doctors. So a woman that is diagnosed 6 months after starting HRT, kind of like me, has likely been developing autoimmunity for years, ever before she picked up that very first prescription. So one more thing, and this matters specifically for lupus. Lupus is known to be estrogen sensitive. That's a specific conversation to have if this applies to you, not a blanket conclusion about HRT and autoimmune conditions. All right, so what does the full research picture on HRT and autoimmunity look like? The observational studies, like this one, show higher diagnosis rates. Basic science shows that estrogen can amplify certain immune pathways, particularly lupus. But randomized controlled trials, which are higher quality evidence, tell a much more nuanced story. The Selena trial found that HRT did not significantly worsen lupus disease activity in women that were already into remission. And systematic reviews show that HRT is generally well tolerated with autoimmunity. And critically, autoimmunity is not one diagnosis. There are more than 130 different autoimmune conditions. So a study with the findings specific to lupus tells you nothing about how it will apply to women with Hashimoto's. This is a piece of the picture. This is not the entire picture. So coming up, the biology that actually explains why autoimmunity clusters around midlife, and it has very little to do with what you're taking and a lot to do with what's been building. So let me say it plainly. Perimenopause and changing hormones does not cause autoimmunity. It removes compensation. That's a very different statement than what you're hearing in headlines, reels, TikTok, or forums. And I know because I've seen the post. The common thread isn't one hormone, it's hormonal change and shifts. Estrogen works as an immune modulator. During our reproductive years, it buffered a lot of immune responses. In perimenopause, the regulation becomes unstable and then estrogen declines. And sometimes, like in my particular case, restoring part of the hormonal picture doesn't fix everything. What it does is expose what was never hormonal to begin with. Add decades of stress load, shifts in the gut microbiome or leaky gut, post-viral immune shifts, years of being dismissed for vague symptoms that didn't lead up to a disease classification. Perimenopause does not create autoimmunity. It reveals what was already building. Most women don't get answers because they don't know what to ask or how to ask. So if you're concerned about symptoms that are not alleviated by HRT or that you might have autoimmunity, here's what to ask for. Can we run an ANA panel? I'd like to run thyroid antibodies, TPO and thyroid globulin, not just TSH. If my labs are normal, but I still feel this way, what's our next step? How long would you want to see these symptoms persist before considering a basic autoimmune panel? And if you have autoimmunity in your family history, mention it every single time. It matters. Once again, the average delay is 4 to 7 years from symptoms to autoimmune diagnoses. And this list of questions can help you shorten that window. The headlines will keep coming. The fearful reels will show in your Insta feed. I'm not here to tell you what to do about HRT. That's a very personal decision you need to make with your provider who knows your full family history, your symptoms, and has the full body of evidence. I am here to make sure that fear doesn't make the decision for you. If I had seen this headline earlier, I might not have started HRT at all. And I might not have a diagnosis of 3 autoimmune conditions, but I would still have the autoimmune conditions and be wondering what was driving all of the symptoms. So when you come up with new research, ask what the study design was. Ask about the study's limitation. How can we generalize these findings to other women or other symptoms or other situations? Ask whether it shows just association or causation. And ask whether it applies to your specific situation. I'm Erica Christine, and the Midlife Health Detective is a channel for women in perimenopause and menopause who want grounded answers, not hype, not guesswork, and not headlines and fear making the decisions for you. So if this video resonated with you, subscribe, because in this channel, we're going to go deep into all things hormonal, metabolic chaos, and autoimmunity. Thanks for watching. I'll see you in the next one.